what are these muscles and why are they so important?
I'm Jill Angelo, host of the Geneve podcast series for women's health in midlife. I speak with the most forward-thinking experts in the health and wellness industries. These experts are helping women 40 plus feel confident and in control of their health in the most vibrant years of their lives. So join us on this journey of women's health.
Modern life can be a pain in the butt, literally. Pain in our privates, pain in the groin, the vagina, the penis, and yes, the butt can all start with our pelvic floor. And that pain can be managed, but it might take some professional help. I had a great and very helpful conversation with Dr. Susie, a licensed doctor of physical therapy and a board-certified pelvic rehabilitation practitioner. In addition to knowing a lot about your private parts, she's also a certified health coach. Simply put, she's the doctor for everything down there.
Susie, it's such a pleasure to have you here with us today. The pelvic floor and understanding that part of the body is a mystery to many. And I'm sure that you encounter that all the time. And so let's start first with what you do, because I think it's so intriguing. You say you're a physiotherapist for your private parts. Tell us a little bit about what that is.
Sure. And thank you so much for having me on the show. It's a pleasure to be here with you, Jill. So in a nutshell, I'm the doctor for everything down there. Not a gynecologist. Most people will think, are you a gynecologist, urologist? I'm actually the musculoskeletal expert for muscles that exist in your nether regions. And most people, like you said, are not even aware that there's muscles down there that aid with sexual appreciation, pooping and peeing. And there's a whole mechanism and mechanic that happens down there that most people are not aware of. So I educate a lot about that part of your body and how it connects with the rest of your body, and also how it is involved with your everyday functions, like I just described, pooping, peeing, and sex. Amongst the physical things, but also emotionally, there's a huge connection with the pelvis and your genitals. So
it's amazing how one small region of the body can represent such extremes, from sexual pleasure to the necessities of life of pooping and peeing, as you say. And yet we know so little bit about it. So let's start first with just what are some of the basic education components you often find that you have to share with your patients?
Great question. First is, what are these muscles and why are they so important? Well, these muscles are, if you take a look at the anatomy, you've got your hip bones or your pelvic bones on top. Those are usually the bones that when you put your hands on your hips, you feel. And then if we were to kind of just slice someone in half and take the top off, and as if we were looking down into a well or a cereal bowl, for example, I always like to call it. And the bottom of the cereal bowl is your pelvic floor muscles. They extend from the pubic bone all the way to the tailbone. And they act like a hammock for sphincteric control, for support and stability, for sexual appreciation. It's very vascular. It's it's innervated by a lot of nerves, and you have multiple connections to this part of your body, from everything from below to your feet to everything from above down to the pelvic floor. So it's all connected. Your digestive health and your abdominal organs are also connected to your pelvic floor. And interestingly enough, your breathing pattern and your diaphragm, which is your breathing muscle, also impacts pelvic floor function, abdominal pressures, parasympathetic, which is a rest and digest nervous system response or stimulation. So all of those things actually are major role players in everyday function and activity.
And why is it that, I'm sitting here as soon as you said, if you feel down, and put your hands on kind of your hips or whatever, that's the top of it. And so I'm doing that. Why is it so difficult for us to have kind of sensory understanding of all the different components of that hammock as you described it?
I think it's multifactorial, really. I think it's our beliefs or how we grew up, how comfortable we are of this part of our body. I grew up very differently. I grew up not being afraid to say penis, vagina, and to explore my genitals. So we were very open with poop and pee and sex and all that sort of thing. So it depends on someone's comfort level and also their experiences with this part of their body, I feel like. If there's any type of trauma, emotional or physical trauma, fears associated, whether that's pain, if someone, for example, men or a male or a female has pain associated with pleasure in this area, it can be quite daunting to wrap your head around connecting with this part of your body. So, and the overall awareness, we tend to we don't focus on any part of our body unless we're getting signals to focus there. And usually it's not always pleasure that we're so concerned with. It's always the opposite of, wow, I'm having pain, or I'm having incontinence, or I'm dry, or it smells or something, So it's oftentimes, we're brought to heighten our awareness to this part of our body because there's usually sadly some negative correlation to bring our attention there. And then we have to I work with my clients to really unravel the story and explore that part of their body in a safe and healthy and loving way.
What are some of the most common pain or discomforts that you see in your patients relative to pelvic pain that you can help them with?
Pain with intercourse is one big one. Abdominal pain or lower abdominal pain, or some might call it interstitial cystitis. Now it's being called bladder pain syndrome. There's a lot of names that are thrown out there in labels, but ultimately it's just any type of discomfort down in this region, whether that be with sitting, feeling a sense of pressure. For women, symptoms of prolapse, which might be, lower back pain, not always, but lower back pain or a sense of something falling out of their vagina, constipation, pain from hemorrhoids, rectal pain, tailbone pain, groin pain, painful orgasm, painful ejaculation for men, penis pain. So it could be a deep pain in the butt, literally, so a lot of these symptoms, such as groin pain or lower back pain, or what one might think in the musculoskeletal world or orthopedic world, piriformis pain syndrome or sciatica, could be really, honestly, a combination of pelvic floor dysfunction. And just, some providers are just not asking the questions to just really get into the deep, the depth of the issue going on, because it's certainly multifactorial.
Yeah. And I think what's interesting about what you went through there is that the pain can start, I think, in the pelvic floor region, and yet it can kind of spread into so many other areas. So I can assume people are confused about that, confused about, well, I thought the pain was in my butt or in my penis or wherever. And yet it's totally correlated or related to the pelvic floor. And and is it starting there, or is it spreading to there?
Oh, it could be spreading. It could have started there, but the signals were not... the SOS signals were not paid attention to, right? It could have been maybe a minor ache. We're just not paying attention until the signals get really loud. And usually that's an accumulation over one's lifetime, stressors, whether that be environmental, physical, emotional. It's a habitual pattern of holding in our body. And then, we get a painful response. And that's not always necessarily correlated with a stimulus. It's just, it's a way of our body communicating to us. So whereas some people might have issues with their neck, shoulder, headaches, migraines, others will have a headache in their pelvis, no pun intended, and that's actually taken from a book I've read. So yeah, it's multifactorial. The symptom generator is not always where you're feeling the symptoms, because pain is actually really generated and perceived 100% in the brain. So this whole construct with the brain and the nervous system and how that all works is very complex, and pain scientists are really doing wonderful research now to discover the real meaning behind why someone has persistent or chronic symptoms. It's not just in the tissues itself, but other issues that perpetuate the cycle or keep one in that anxiety, guarding, tension kind of cycle.
It's not just women who suffer from pelvic pain. Men can too. In fact, Dr. Susie is the author of Pelvic Pain, The Ultimate Cock Block, and the creator of a unique hands-on training program for helping men with pelvic pain become experts in treating themselves. I encourage you to check it out.
Let's talk a little bit about treatment. I'm sure people got to be nervous coming to you because it is such a sensitive part of the body. So how do you approach your clients, and how do you approach them initially, and then what does treatment look like?
Great question again. Love it. You're absolutely right. That's a big topic of the fear associated with going to see someone who's going to assess their private parts, and most people who get referred to me don't really know what to expect in the first place. So there's a lot of anxiety associated with it. And so the first step is to just build trust and consent, really, and over the phone or whether and be in person. And I educate a lot. So what I would go through is very much so like we went through in the first question that you asked about, what is the pelvic floor? Why am I going to explore this area? And the more knowledge that one has about what's going on, the more comfortable and at ease that they'll feel proceeding with an examination or assessment. Because it oftentimes does involve an internal assessment, which is a single-digit palpation, either vaginally, rectally, or both, depending on the client. And it depends on their comfort level. I'm not a fan of pushing or, saying like, oh, we have to do this, otherwise I'm not going to get enough information. Does it give me more information? Sure. But do I want to be another danger for someone after they've been through so much or have seen many providers? Not necessarily. So we just work around their comfort level. Ask for consent, and after that, they're typically I answer all their questions, and they're really comfortable with proceeding with the exam. And I'm constantly just checking in on them on the table, and when we're doing things, is this comfortable? Can we proceed? Is this okay? How are you doing? And that gives them a sense of security and safety.
And are you doing any kind of massage therapy, or is it purely just examination and then the treatment comes through other types of exercises or, regimens that you want your patients to follow?
Sure. It's first starting with stress is a huge trigger for a lot of people. So I usually take a biopsychosocial approach, which is looking at the biology, which is the physical aspects. It could be physiological as well. And then I look at the social constructs and then the psychology as well. So the psychosexual components, because you just don't know whose story is going to end up in your office. And you have to look at them from a holistic perspective, from a whole, instead of just a body part. So I think that's important to understand is treating holistically and integrate in an integrative way, so that they feel comfortable and you're actually getting down to the root cause. So I would essentially, if they're coming in with pain, for example, I would certainly look at what their breathing pattern is like, if they have any restrictions anywhere around the diaphragm, for example, or in their cervical spine, because you have a whole when the breath enters the body, it actually facilitates mobilization of the cervical, thoracic, and pelvic diaphragm, and they all work together. And so if there's any kind of blocks or barriers or restrictions in mobility in those areas of the body, then we want to certainly address that so that we can decrease any sort of compensatory or postural or tension type of pattern. And then just kind of going through them of feeling comfortable with touch, enhancing awareness of what these pelvic floor muscles are doing throughout their day. So I'm a huge fan of teaching them how to feel when tensions rise in their body, especially in the pelvic floor. Are you butt gripping at the grocery store waiting in line? Are you tightening your abdominals or holding your breath throughout the day? And what situations tend to trigger that in our bodies, right? What situations or stressors cause a discomfort? And oftentimes it's, kind of having to sit with that and reflect. So I do a lot of curriculum associated with finding our triggers and reflecting on our day's stress and what we can do to reduce and then eventually eliminate those triggers after we recognize them. So there's definitely a hands-on component which does involve connective tissue work. I do a lot of the connective tissue mobilization, soft tissue work, neural manipulation, visceral manipulation, and that's just working the fascia and the structures around the organ systems. Vascular work like lymphatic, musculoskeletal work, trigger point or tender point release, stretching, and again, just empowering the client to be independent and essentially just treating themselves and being able to self-manage and being more in control of their body and their symptoms, and that way their chances of success are very high at that point instead of being a passive participant.
That's great. You know, even just talking to you, I'm so much conscientious of my breathing patterns, and I butt grip all the time. And I don't know, it must be where I carry my tension, or it's my, I'm giving my core a rest, and it's like how I'm holding myself up or something. I don't know, but I am that person. I tell you. We're
totally taught to like hold our stomachs. I mean, lots of women that come into my office are like, I thought it was good to hold your abs in all day. It's a good workout. And I said, not necessarily if you're doing that for like your stomach needs to rest. Like you're compressing, like your organs are not that deep. I mean, they're pretty superficial. And if you're tightening every single, Hilton's law is a law that says every single nerve that innervates the skin has a feedback to the spinal cord and back to your organ system. So if you're tightening your abdominals and holding them tight and gripping and shallow breathing, it's just kind of sending a paradoxical or an efficient message back to the organ system. And that can impede metabolism, motility, like in constipation and digestion and absorption, right? All these IBS symptoms and Crohn's and that sort of thing, or an irritable bowel disorders. Those can oftentimes stem from just really a habitual pattern of guarding and tension and anxiety that's feeding back to the brain and then spitting back out a response in response to what's happening physiologically with the body. So there's a two-way highway there.
That's, it's so true though. And it's kind of like something for almost everybody to practice and learn from and think about. It's so much more pervasive. Okay, I want to talk about orgasms.
I'm sorry, that's really all the time we have for this episode. If you want to hear part 2 of my conversation with Dr. Susie, where we talk about, yes, the big O, be sure to stay tuned at Gennev.com. Thanks for listening, and I'll see you again soon.
Thanks for listening to the Gennev podcast series. We welcome your feedback at Gennev.com. That's GENNEVE.com. You can follow us on Facebook and subscribe to us on iTunes or Stitcher, and you'll never miss an episode. The Gennev podcast series is produced by Shannon Perry. Theme music by Smitty. And until next time, watch the Gennev website for new stories and offers all dedicated to women's midlife health.